Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 2 of my multi-part video series of doing so. Today, we will be taking a look at anemia of chronic disease. Without any further delay, let's go ahead and get started on today's content. All right, let's start off by taking a deep dive into anemia of chronic disease. Definition: anemia presenting with decreased hemoglobin levels in patients with chronic inflammatory conditions like renal failure, autoimmune diseases, for example, rheumatoid arthritis, juvenile rheumatoid arthritis, inflammatory bowel disease, systemic lupus, erythematosus, hepatitis B, hepatitis C, HIV, or malignancy. Lab findings: low iron but normal ferritin. Iron is sequestered in cells due to cytokine-mediated inhibition of iron release and hepcidin-induced decreased gut absorption. Treatment: address underlying condition. Erythropoietin therapy, specifically for anemia of chronic disease associated with renal failure. Next, let's take a look at some key points regarding anemia of chronic disease. Anemia of chronic disease is characterized by low iron and normal to high ferritin. Treatment varies based on the underlying condition. Erythropoietin therapy is specific to renal failure-associated anemia of chronic disease. Note: mean corpuscular volume may be normal or low in anemia of chronic disease, with USMLE often presenting cases with low mean corpuscular volume to test recognition. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 45-year-old female with a history of rheumatoid arthritis presents to the clinic complaining of fatigue and weakness. Laboratory findings reveal decreased hemoglobin levels and low iron levels, but normal ferritin. Which of the following is the most likely cause of her anemia? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. This patient's presentation of decreased hemoglobin levels, low iron, and normal ferritin levels is characteristic of anemia of chronic disease. In patients with chronic inflammatory conditions like rheumatoid arthritis, cytokine-mediated inhibition of iron release and hepcidin-induced decreased gut absorption lead to low iron levels despite normal ferritin. Treatment focuses on addressing the underlying inflammatory condition, and in cases where renal failure is the etiology, erythropoietin therapy may be indicated. Therefore, the correct answer is B, anemia of chronic disease. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, iron deficiency anemia. This choice is incorrect because iron deficiency anemia typically presents with low iron levels and low ferritin. C, hemolytic anemia. While hemolytic anemia can result in decreased hemoglobin levels, it is not characterized by low iron levels and normal ferritin. D, aplastic anemia. Aplastic anemia is characterized by pancytopenia and bone marrow failure, not specifically by low iron levels and normal ferritin. E, thalassemia. Thalassemia may present with microcytic anemia and abnormal hemoglobin synthesis, but it is not typically associated with low iron levels and normal ferritin in the absence of chronic inflammatory conditions. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old male with a history of Crohn's disease presents to the emergency department with fatigue and pallor. Laboratory investigations reveal decreased hemoglobin levels and low iron levels, but normal ferritin. Which of the following mechanisms best explains the pathophysiology of his anemia? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The patient's presentation, characterized by decreased HB levels, low iron, and normal ferritin, suggests anemia of chronic disease. In chronic inflammatory conditions like Crohn's disease, cytokines such as interleukin-6 and tumor necrosis factor alpha inhibit iron release from storage sites, leading to decreased iron availability despite normal or elevated ferritin levels. Therefore, the correct answer is D, cytokine-mediated inhibition of iron release. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, increased erythropoietin production. While erythropoietin production may be increased in response to anemia, it does not directly explain the low iron levels observed in this patient. B, hemolysis of red blood cells. Hemolysis would result in decreased HB levels, but is not typically associated with low iron levels and normal ferritin. C, decreased gut absorption of iron. While decreased gut absorption of iron can occur in some conditions, it does not fully explain the low iron levels in this patient without addressing the cytokine-mediated inhibition of iron release. E, excessive destruction of platelets. Platelet destruction, thrombocytolysis, is unrelated to the mechanisms underlying anemia in this patient and would not lead to low iron levels. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.